Namaste and welcome to the next episode of Clinical Ayurved. Myself Dr. Mayuresh Agte. We are discussing Rudro and we are discussing different clinical manifestations of Rudro which we come across in our clinical practice. We have seen the infart, we have seen the cardiomegaly aspect, and now we are seeing the atherosclerosis phenomenon. In last episode I told you that there is an internal uh, accumulation of the cholesterol, or you can say lipids, and the blockage of blood vessels starts forming in the heart. So to reduce this accumulation is the treatment which we will prefer will be lekhan, scraping of this internal coating in the blood vessels of the heart. See the difference. This is Vedan when there is infarct, and when there is condition like atherosclerosis, you have to scrap this one. If it occludes whole lumen, then again here also you will need Vedan karma. So what will be the line of action? Dosh, of course, is a kapha dosh. Then Meda Sanchay, Kapha Meda Sahacharya, and Lekhanam Pattalikaranam. You have to scrap this Sanchita Meda, and hence the drug which will be useful are all of Ruksha Ushna Guna, like Gugul, like Vacha, like Haridra, like Shilajatu. So drugs which have got Lekhan Karma, and if more priority will be the drugs like Shilajatu or Kanchana or Gugulu, which have got a very nice action on particularly on the Meda Dhatu. So here Gugul Kalpa like Trifala Gugul, Kanchana Gugul, Kaishor Gugul, all will be in the line of action. Now remember, we are discussing atherosclerosis, we had discussed the infant, etc. I have considered that as a heart as an organ only. What it means, if there is some system pathology or atherosclerosis because of some other reasons are also contributing, then you have to think of these aspects also. For example, a patient is already have high level of cholesterol, Medorogi or Stolya, then you should know, you should treat that disease as a whole as such also. I am just giving examples of the heart diseases which we come across very commonly in fact. That's why we are talking only about heart. But if these conditions of heart, any condition of heart, is in relation with some other disease or some other clinical manifestation in the body, you have to think of that disease also. So atherosclerosis, Lekhan Karma, and Dravya which have more affinity towards the Meda Dhatu will be more preferable, like Kanchana, like Kaishor Gugul, Plain Gugul, Shilajatu, etc. Always remember, I am talking about only herbs here, but the vessels are very small, Sukshma, Sadhya Pranavarma, and you have to act very quickly for to prevent the further consequences. Hence, here Paragandha Kalpa or Kupipaka Rasayan like Rasa Sindur or like Tamra Vasma are also advisable. As I told you in very first 1-2 episodes that my base will be Dravya Vidyan, and in addition we will discuss the other subjects. So in the case of heart, the Dravya like Rasa Sindur, Savirbandha for pain, Tamra Vasma or Kalpa like Yogindra Ras, Suvarna Kalpa, all are advisable. The principle remains same: infart, Bhedan, atherosclerosis, Lekhan, and for cardiomegaly you have to reconstruct the tone of the heart muscles. So, and in addition, if there is other disease like hypercholesterol or स्थौल्य, medorog, or some kidney manifest, whatever it is, and by which the heart is getting some problem, you have to treat that disease also. In all this case, one thing is to be remembered, that in the case of heart, the manas condition is also very very important. Many of the things, as it Hrudayam Manase Sthanam, all the happenings in our surrounding, in our life, social, financial, whatever it is, all these affect the mind, and that affects the Hruday as a organ. So having manasa vichar is also important, and when patient comes with the report with infarct or any other report, always give time and reach to his mind, his tensions, because many a times that suffocation of surroundings which is going continuously on the mind affects the heart, and we treat only organ, but the root cause which is at the mind level is ignored. Hence, manas vichar of, in the especially in the case of heart, of course, see, manas vichar is manas status affects every disease, no doubt, but specifically in Rudro, manas vichar is very very important, and hence chinta, shoka, bhaya, nairashya, depression, all these manasa bhav are, you have to counsel the patient and take out of him if really they are affecting the patient's heart. We will take manas vichar and rudra in further episode also. At present, just for atherosclerosis, go for the lekhan karma, and for this, and the drugs which I mentioned are very very useful. In next episode, we will come with the next heart anomaly. Thank you very much.